The eyes are on the Jersey Shore. I am Vin Ebenau from my home office with the Ocean County Public Health Coordinator Dan Regenye, talking about the latest updates with the COVID-19 vaccine and looking back a year earlier to this time in 2020 when things were still somewhat on hovering normal, and then everything started to shut down in the days that followed. Ocean County got its first case of the COVID-19 virus, and then we started kind of building from there and everything. And Dan, you've been on the front lines of this since the very beginning and kind of leading charge and everything. So first, I want to pause to kind of welcome you, and thanks for taking out some time to discuss where we are right now with the vaccine, and then for coming up, taking a look at where we've been.
Sure, no problem. Thank you for having me.
So mid-March here, we'll start with kind of where we're at right with the vaccine. So a lot of people have been getting vaccinated, and we're sort of hit that slow motion kind of over the last couple months where either because of the weather or just not enough doses of the vaccine coming to Ocean County from the state, and the state saying not enough coming to the state from the federal government here. So in the middle of March here, where does Ocean County stand with how many vaccines are being delivered, how many vaccines we have now, and how many you're kind of looking forward to possibly getting over the next couple of weeks or so?
Yes, I mean, some of the good news is that residents are accessing the vaccine. There's been 177,000 doses administered to Ocean County residents. Unfortunately, many of those residents have had to travel to some of the out-of-county sites at the mega sites that are quite a distance away, unfortunately. We've administered 60,000. We surpassed 60,000 at our vaccination clinic yesterday in Toms River. So that's been going extremely well. The unfortunate news that we heard today is that we're getting cut back from 3,400 to 3,000 doses of the first dose going into to next week. So between our first dose shipment of 3,000 plus the second dose people, that'll be about another 3,000. But it's really that first dose shipment that kind of sets the tone to try to beef up and get going with trying to increase some of the numbers. So that was some unfortunate news that we received today because we've been doing a lot of planning over the last couple of weeks and trying to get that expansion plan because we were hearing that there's more vaccine coming in the very near future in the next couple of weeks or so, and certainly by the beginning of April. So we've been meeting and doing a lot of work internally trying to get to a point where we have a vaccination distribution model that we have a very fluid process that we can expand into many different areas, but we're looking at trying to set up a third site in the western part of the county, so we would have a triangle between our Stafford, Toms River, and we're looking at Manchester. We met with the Manchester superintendent twice this week doing a walkthrough. We're looking to set up a vaccination site out there the week of the 22nd. We're looking to finalize some of those details, and we have to kind of look at where can we absorb that loss of vaccine, and can we still open that site in Manchester with that loss of vaccine. Also, we were looking at trying to pilot and set up a drive-through vaccination clinic next week to be able to do a small clinic just so we can kind of test drive some of the clinic flow with that, because it is different than a fixed facility. But we want that in our arsenal, so to speak, to be able to offer to the residents that we can take throughout different areas of the county. So we're hoping to set that up next week as well, and announce that in the very near future as well. In addition to that, we did receive some of the J&J vaccine last week, which was a good thing. We received 800 doses of the J&J vaccine. We actually started vaccinating and using some of that vaccine today with some of the at-risk individuals and the hard-to-reach individuals. We're going to continue with that. We are beginning and implementing our homebound vaccination plan, reaching out to some of those individuals that are homebound and trying to look at the caregivers around them as well to insulate that person and give them the maximum protection to protect them as well. So we have the plan to be able to expand. We're trying to get more partners and agencies to assist us with that as well. We do have another entity that we've been trying to work with to get them up to speed, and they're already approved through the state to be able to receive the vaccine, but they just haven't at this point. because of the limited amount of vaccine coming into Ocean County at this time. So we've also, from our testing site, we've at the Ocean County College, we've administered close to 28,000 tests. And what we're looking at doing is contracting that out to free up the nurses and the staff on site there to open up another vaccination site and just reallocate that staff to either a mobile vaccination site or a fixed facility site somewhere in the county as well. So we're looking at trying to roll that out probably next week to set that up as well. So there's a lot of moving parts. We've done a lot of planning under the leadership of Commissioner Director Quinn and our liaison Commissioner Deputy Director Little, with the county administration, myself, and my Director of Administration here as well, looking to try to set that up and move that forward. And we have everything ready to go. We just need some more vaccine, obviously, and some providers to assist us with that as well.
Have you gotten much guidance from the state as to the reason for the cuts in vaccines, not just with this past one, but any previous ones, as to why they're kind of cutting back on the amount of doses coming to Ocean County, and any guidance on when they could start to send more to our area so that people scheduling vaccines or looking to get the vaccine in Ocean County can get it a little bit quicker, as opposed to having to wait a month or two because you guys don't have the vaccines. And it's not your fault. You just don't have the vaccines to be able to give out right now.
Right. I mean, we have not received any explanation other than less vaccine was coming into the state of New Jersey. And it's just frustrating because I speak to these residents and the seniors of Ocean County, and I mean, seniors in general are some of the hardest hit. They're getting the most severe illness. They're experiencing all the hospitalizations of the most severe. These are the people that are dying of this, and we're doing everything that we can to try to get vaccines supplied to them. But it's just not there. It's not coming into Ocean County for whatever reason. So we do continue to advocate. I was on several phone calls today with Commissioner Little, with different folks, and trying to get more vaccine to come into the county. And we do continue to advocate on behalf of the residents of Ocean County. So hopefully that does open up in the near future.
In regards to the homebound and the senior citizens, certainly, and that's something that's been stressed, whether it's with getting a COVID-19 test early on and now getting a COVID-19 vaccine, because they are among the more vulnerable population here. What kind of guidance can you give to those people at home who are hesitant to go out or can't physically go out, either because of any kind of limitation or sickness, that there's a vaccine coming at some point to them, and how do they make sure that they get the vaccine once it's available and they can schedule that kind of appointment? And or I guess with setting up maybe a mobile vaccination unit, when could they possibly look forward to maybe being able to get that vaccine delivered to them at home?
Yeah, I mean, the homebound vaccination component, it's a little bit more difficult to implement because it's a slower throughput. So I mean, we're certainly dedicated to make this happen, and we are moving forward with it. But it's like that 15-minute, this population may have the 30-minute observation period afterwards. So the throughput that we're used to at one of our mass vaccination clinics, obviously we would be nowhere near that. But we would set up some mobile teams that would be able to go out. Maybe they can get to maybe 10 households a day, because if you go from house to house, we have to kind of plan them out geographically to go to some of these sites. We have different sites that we or different avenues by which we can identify people. We've had a homebound seasonal flu vaccination program for a while, so we do have some people on that list already that register with us in years past to receive the seasonal flu shot. We also have had people emailing us and calling us that are on that list, and we'll get them involved with this. We've been working with the Meals on Wheels here in Ocean County, which has a large senior homebound component to it. And working with them to try to get them involved in the process to get that. And then through the county OEM, we have the Register Ready, which is a list of people who are homebound that are registered with the Ocean County Office of Emergency Management. In the event of an emergency for evacuation, they're on a list for local law enforcement and first responders to know that they're there, that they can evacuate them or take care of them during that time. So we do have some lists that we can certainly start with. But if any residents have that need, they can certainly contact us, and we'll get them on the list to put them into queue.
I know you said you're kind of looking to get some other agencies involved with the vaccine process and everything, but do you have the staff you need at each of these vaccination sites, or in the plans you're working on right now for additional vaccination sites or mobile vaccination sites, the staff, the nurses, the resources you need in these places kind of set up, or are you still looking for more? I know when you and I spoke a couple months ago back in January, it was kind of like maybe looking for a little bit more to kind of help facilitate what's going on at each of these vaccine clinics. Is that still the case? Do you still need more people to volunteer and kind of help with the share the load?
Yeah, I mean, we definitely need more providers in the game to be able to meet the need that's here in Ocean County. And by providers, it's both agencies and vaccinators. So I think we need to have more entities try to look at getting up to a larger scale vaccination component serving the residents of Ocean County. And from the perspective that we continue to bring people on and hiring them in a seasonal capacity. We probably have about 150 seasonal employees that are helping with everything. I remember the vaccination is the thing that's forefront right now, but everything else is still there. I mean, we still have the working with the schools and the long-term care facilities, and the contact tracing, the case investigation, our own hotline. There's a whole component behind the scenes on the administration of the vaccination. We're still doing the testing site at the college. So we have literally a couple hundred staff that are working around the clock, almost 7 days a week, to be able to meet the needs across the whole spectrum of our COVID response. That's very robust. And obviously we need to kind of allocate those resources the best that we can to the vaccination piece, because we see that as kind of that light at the end of the tunnel. If we can focus and dedicate our efforts there, we're hopeful that the rest of the response will slowly begin to dwindle, which I think is happening with the vaccination numbers that we have now. We see our cases going down. We see our hospitalizations going down. We see the long-term care facilities in an outbreak status going down. We see all those indicators on the decline, and that's what we want to continue with. And that's where I think we really just need to make that final push over the next couple of months. And hopefully by the latter part of spring and early summer, we can be at a point where we have a large number of people that are vaccinated here in Ocean County to provide that level of herd immunity, so to speak, to be able to offer that protection, so people can be safe and feel safe going out of their home. I mean, it'd be great just to reunite grandparents with their grandkids and things of that nature. So I was kidding around about a month and a half ago when we started the new year, and I said I want to declare 2021 as the year of handshakes and hugs again. I mean, we've gone away from that, for the last year. It's just this weird, awkward feeling that you meet somebody, you can't even shake their hand. They're afraid you give the elbow bump or something. And what's great, I think, with the vaccination clinics from my own perspective, I think also with some of my staff, is that it allows us to engage face to face with a lot of our residents. We've had 60,000 people come through our door. We've been able to talk to that we haven't seen. So it's putting a face to a lot of these things that we're dealing with. And the interaction, I think, is great from a professional perspective, because it puts a face to the need from a COVID side of it. But it also reminds us why we're here as public health and as people across the board trying to respond to this COVID response. Just some of the stories and talking to some of these people, I mean, there are stories that they tell over the last year. It's just heartbreaking to hear some of what they've gone through, and they're afraid to go out, and just the ability, you think they hit the lottery when they walk through that door at the vaccination site, and their eyes just light up like this is the end for them, to be able to move on with life and get back to some set of normalcy with it. And it's refreshing, and it recharges your battery. And I think that's done the same thing with a lot of the staff here. And they're already extremely tired, and they've been going 7 days a week for over a year now. And I'm just very fortunate and blessed, I think, with the great team here with the Ocean County Health Department and the support through the Board of Health and the county administration and the Board of Commissioners. And it's really just been a phenomenal partnership, and all the external partners as well. I mean, it's the medical community over the course of the last year, and the first responders and the sheriff's department. It's really everybody has stepped up. If we can just kind of focus and just keep driving for a couple more months, I think we can get out of this and be in a much, much better place.
You know, I remember it takes me to a conversation you and I had on the beach boardwalk area in Seaside. I believe it was in July. Just on, okay, well, what do people need to do when they go to the beach? Do they need to bring the extra mask? When do they have to wear? When do they have to be socially distant? What do they have to pack in their beach bags? You know, these new kind of guidelines so that everybody was protected and safe and that they could still have a good time as well. Do you see a lot of those, anticipate a lot of those same kind of practices going into effect this summer, especially with kind of how things are trending vaccination wise? I know the President Biden is anticipating a happy, healthy 4th of July for everybody, kind of speeding up the vaccination process. But given the way things are trending just overall right now, do you think that it's possible that we could have a normal summer, if you will, the new normal, the next normal this summer in Ocean County and the Jersey Shore with, we go to the beach, we go to the boardwalk, all those summer fun activities that we like to do, that they can be, you know, those handshakes and hugs and kind of getting to know people again with that kind of herd immunity, that vaccination rate up at a much higher rate than it is right now in the middle of March.
Yeah, I would certainly be hopeful that we're going to get to a point that that's going to happen. I would be hopeful that if we can get the vaccine out and get the ample supply, the summer can be what it used to be not too long ago. So, I mean, the main concern, I think, from masks and things of that nature, and I would hope that there's a lot of data that comes out over the course of the next couple of weeks and months, and so to speak, because the concern now is the variant. I think that's the main thing. That's holding us back from a lot of this. When you're looking at, well, why do I have to wear a mask if I'm vaccinated, or why do I still have to quarantine and things of that nature? And it's really the concern of the variant, and we want to make sure that the any transmission of variant strains of the COVID don't put us back to where we were just a year ago. So that's, I think, the main concern right now. I think we need to collect data and get a couple weeks and months of good, solid vaccination rates, and looking at the contact tracing and the disease investigation side of it, and look at those people that are getting the active COVID infection. Were they vaccinated? And looking at the variant strains that are out there and trying to take a look at them if they were vaccinated, and is the vaccine protecting those individuals related to that? So I'm very hopeful that I'm hopeful this summer will be what it used to be just 2 summers ago, and we can get back to that. And I would like nothing more than that.
Taking a look back real quick, and you touched on it nicely just a couple moments ago, but looking back at the journey that's been, and it's felt like a lot longer than a year since this time last March when, you know, I believe it was a 70-year-old Manchester man was Ocean County's first case, and there was a pregnant Toms River woman among that first 5, and people, it was just one case after another, and then a few cases, and people are still trying to figure out what's going on, certainly around the world and around the state and in Ocean County as well. Okay, well, this person's getting infected, that person's getting affected, and then, okay, how do we get this information? Where is the information coming from? What do we do now? What guidance do we give out? So how have you and your team, the commissioners, the emergency management office, the sheriff, kind of everybody kind of adapted to all these different changes and nuances over the past year to get through all that testing to make sure people were getting tested, and now that people are getting vaccinated so that we can return to that pre-pandemic world, or return to a new, better, healthier world here moving forward? So what is that timeline? How have you seen that timeline progress and overcome a lot of those challenges that have come on a daily basis?
Yeah. I think when you kind of look back and reflect on the last year, and then even going forward, and even looking at some of the past emergencies that you responded to, and Sandy and H1N1 and all the others, I mean, there's been a lot over the course of my 28 years here. So you have your plans, and they're in place, and you have a general idea of what you would do in different situations. But No plan should be so rigid and black and white in the sense that it's a cookbook approach to it. So, and I think we've seen that in every type of an emergency where you have to have your basic core team in place and process in place, but you have to be able to adjust on the fly based on what's being presented at the time. So, over the course of the last year, I would say going from day to day, week to week, month to month, it's been a constantly evolving situation with different like sub emergencies happening, the bigger issue going on, and just trying to deal with each of them individually. Some of them could be like a stakeholder specific and working with first responders or law enforcement or schools or hospitals or whomever that is, the general public, seniors, kids. Um, so you have to kind of be flexible in the sense that have your core skill set or knowledge of a situation, and then be able to meet that challenge and being able to act in a fluid manner to be able to adjust to the situation over the course of time. And it's just what we've learned over many years in emergencies. So I think we get better each time. Um, and a lot of things that we're actually putting in place now from our COVID response, and more specifically the mass vaccination. There's things that we're doing now that was an after actions and the lessons learned from H1N1. And a lot of that is looking at some of the staffing side of it. So over the course of the last 10 years, we've taken staff internally and incorporated them into our seasonal flu program to understand the basic clinic operations to be able to run a basic clinic and then just scale it up. So over the last 10 years, we've had non-traditional staff work as clinic managers. And I think we're seeing some of the benefit of that now because we have people that are used to running clinics, while be it much smaller, the basics of that clinic are very similar. Then you just kind of ramp up and you build up from there. So that's just one example of as a learning organization, you try to take that information and learn from each thing to the next. And we've learned a lot over the course of those years with it, and we'll learn a lot from this one in whatever the next one is after this. Who knows what that'll be, and hopefully that'll be after I'm gone. But we have a lot of people here that are very talented in passing the torch, just the way the torch has been passed to me at this time. So you try to learn from the past responses and emergencies, and you build upon that, and you get better as an organization, you get better as a person and people. So.
Dan, last question I have in regards to just kind of where things are at right now. I know there's been a couple times in the last couple months where there's been a lot of emails or phone calls coming into the Ocean County Health Department with people looking for information, people with questions, looking to schedule tests or vaccinations. So, and you guys have even put out a couple other numbers to try to spread out the wealth, so to speak here. So, how are things going along with that right now? And where should people go if they have questions, or if they're having any issues scheduling tests or scheduling vaccinations? That seems to be a popular question that comes up among Ocean County residents is, okay, where do I go? If I have this or that, or how do I get the answers?
Yeah, I mean, everything is kind of channeled and funneled through our website at ochd.org. You have the information for our testing site, our vaccination, the call center information. We did get flooded with phone calls coming into our hotline here at extension 7411 that we had to actually contract out to a professional call center and working with the county to have that set up. So right now we have a call center that we've contracted with to be able to channel some of those calls and be able to answer some of those questions in the most basic way. Some of those people do get channeled back to us if it's something appropriate. We need to be able to follow up and have that conversation. But that's helped quite a bit. On the testing side, I think the demand is diminishing across the board. I'm not aware of anybody having an issue trying to schedule a test with us. You can get a test pretty quickly at our next testing date. Even today alone, we did only 154 tests over at the college. I mean, back in the peak, we were close to 400 each day with that. So that demand is diminishing. The biggest question right now is the vaccination front and trying to get an appointment for the vaccine and I mean, from that perspective, we're doing everything that we can. We've administered 60,000 shots so far. So obviously those appointments are opening up. I would just encourage the residents to continue to look on our website. I thank them for their patience. Unfortunately, at this time, that the vaccine supply is nowhere near what the demand is that's out there. But we are here to help them, and if there's seniors that need assistance, they can contact us, and we can do everything that we can to try to get them vaccinated. I know that the schools were recently identified and put into the mix, which is a great thing. As a parent of two school-age kids, I fully support that these schools need to be open, and I understand that. I see it day in and day out with my own two children. But it's how do you do that safely? How do you do that effectively? Let's do everything we can to try to get the teachers and all the school workers vaccinated. But it's a give or take. If you get all the teachers in school vaccinated, then you're leaving all these seniors out. So where's that balance, and where's that state of equilibrium that's trying to get everybody the vaccine to the best of our ability? And like as we opened up, it doesn't help when we get cut 400 doses of vaccine coming in next week. So it's kind of like we're taking 2 steps forward and then 3 steps back, and then another step forward, another step back. It's just very challenging, and it's frustrating on our part as well. I certainly understand that our residents and our seniors and our school employees are frustrated, but we are equally as well with this, and we're doing everything that we can. I assure you of that, to be able to solicit and advocate on their behalf to get more vaccine into Ocean County.
Dan, I appreciate you taking out some time today to discuss the updates with the vaccine and certainly with the pandemic as a whole. And, I know you and I have had several conversations, either in person, over the phone, kind of just throughout this pandemic, breaking things down as to where they currently stood at that point and trying to look ahead the best we could as to where things could be heading here. So I appreciate you always taking out the time, and certainly for all the work that you and your department are doing to get all the information out to everybody in Ocean County, make sure that people get vaccinated and tested early on and everything else. So hopefully the summer of 2021 will be much, much better.
I hope so. I look forward to that interview on the beach again in July.
Sounds good. And hopefully it's not as much about COVID as it is about summer safety.
That'd be great. Sunscreen in fluid. Drink lots of water.
Yes.
So.
That is Ocean County Public Health Coordinator Dan Regenye. I am Vin Ebenau. Thank you to all of you for watching Eyes on the Jersey Shore. I'll see you next time.